A very good afternoon, everyone. I'm Sayukta, your host for today's live from All About Skin Wellbeing team, and I'm sure all of you must be doing really good. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some point of time in their lives. Now, urticaria is characterized by a round rash on the skin that itch a lot, and it may be due to chemicals in certain food items, allergy to certain medication, insect stings, sunlight, and sometimes the cause is even unknown. So today we are going to talk about urticaria, and ladies and gentlemen, girls and boys, we have with us renowned dermatologist Dr. Anirudh. He has completed his post-graduation MD in dermatology, venerology and leprosy from the prestigious Bangalore Medical College and Research Institute, securing top rank from Rajiv Gandhi University of Health Sciences 2018 batch, and worked in the capacity of senior residence at Victoria Hospital, BMCRI. He has qualified the Diplomat of National Board DNP examination in dermatology and a board certified dermatologist by National Board of Examinations in Medical Sciences, New Delhi. He also has to his name the prestigious specialty certification in dermatology from the Royal College of Physicians UK, MRCP UK. He also has diploma certification from the European Board of Dermatology and Venerology as an international specialist candidate. He has completed his fellowship in aesthetic dermatology affiliated to Rajiv Gandhi University under the guidance of Dr. Venkataraman Mysore. His experience in treating all skin, hair, and nail disorders. He has presented academic posters and papers at various state level and national level conferences, and he is also a member of the Indian Association of Dermatology, Venerology, and Leprosy and Association of Cutaneous Surgeons India. A very warm welcome to you, Dr. Anirudh. It's a pleasure to have you with us today.
Thank you. Thank you for the introduction.
So, Doctor, as today we are going to talk about urticaria. First of all, we would like to understand what is urticaria.
So, urticaria, if you break down the word, it's derived from the Latin word called urtica. So, urtica in Latin means burning. So, it was discovered in the ancient Europe when people used to get in contact with the shrub called the stinging nettle. So, whenever they used to get in contact with this shrub, they used to get these kind of rashes. So, even now, the scientific name of these shrubs is named as urtica. So people used to get these rashes, and this was associated with the allergies as well. So finally, in the 18th century, the name for this condition was named as urticaria. So urticaria is not only seen in contact allergy, but also in many conditions, as you said in your introduction. So this is
Right.
what now is synonym. It has become synonymous to allergy, but urticaria and allergy are different. But most commonly, allergy presents as urticaria.
Right. So, most commonly, allergy presents as urticaria. Are there other causes as well, doctor, for urticaria?
See, urticaria is mainly of two types: one which occurs spontaneously, and one which can be induced. Okay. The spontaneous ones, if it is for a short period of time, so we call it as acute urticaria, and if it stays for a longer duration, mostly for definition purpose, we take it as 6 weeks. So if the rashes is on and off since 6 weeks, more than 6 weeks, we term it as chronic urticaria. So these come under spontaneous urticaria. Well, their urticaria can also occur because of other stimuli, external stimuli. So this we term it as inducible urticaria. Inducible urticaria can be again because of various stimuli like physical factors. It can be because of contact with cold air, or because of heat, or because of pressure, or because of vibration, or because of delayed pressure, and many more things like that. And even the contact allergy comes in this category, because whenever you get in contact with a particular substance, so you get these rashes. So it becomes an inducible form of urticaria. And believe it or not, some people get these kind of rashes when they go out in the sun, when they are exposed to sunlight. So this form of urticaria is called solar urticaria.
Right.
So these are
So,
the
there are,
basically, yes,
yeah, various types of urticarias as well.
yes.
Doctor, because we are talking about urticaria, and as a layman, anything that bothers our skin, that, itches, forms rashes, for us, I mean, it's very, intolerable. So, how does it looks like? As a layman, how do we know that what is bothering us is urticaria?
Yeah, so you have to understand that not all rashes are urticaria. So urticaria is basically the occurrence of hives, or in dermatological terms, we call them as wheals. Wheal is basically the swelling of a part of a skin surrounded by redness, and you get that itching sensation or burning sensation. So it's basically the skin is on fire. So that is what urticaria means. So you will get that anguish to scratch yourself. So, urticaria can be localized, and sometimes, most commonly, it occurs on the entire body. And like I said, it can be because of exposure to various substances. So,
Hmm.
if you get a solar urticaria, maybe it can occur on the sun exposed areas first and then involve the rest of the body. Or if you're there is pressure urticaria, the part which is in contact with the certain substance may get the rash first, and then it may move to other areas. So this way you can distinguish other rashes from urticaria. Most commonly, urticaria is spontaneous. It occurs in a few minutes and is generalized and commonly seen in young adults.
Okay. Doctor, is urticaria a serious disease, or what are the potential complications of urticaria if it is left untreated?
Yeah, like I said, urticaria can be a sign of allergy, but urticaria can occur in severe forms of allergic reactions as well. So the allergies can be because of certain medications or underlying infections or any substance. Suppose a person is getting a CT scan done, so they inject something called a contrast for the
Right.
imaging. Yeah, so when such kind of substances, external substances are introduced in your blood, so they can suddenly cause a reaction which we see as urticaria, but there is more to it. So it's called anaphylaxis or anaphylactic shock. Urticaria can be a part of anaphylactic shock. In such cases, it is serious. Otherwise, the rash is just maybe it stays for a few minutes or few hours, but not more than a day. If it stays more than a day, then it has to be re-evaluated. May look like urticaria, but may not be urticaria.
Right. Now, a very common tendency in our society, whenever we get anything on our skin, especially, we will run for some home remedies or DIYs. DIYs are so common these days thanks to our social media influencers. Then we have over the counter medication because chemist shops are so easily accessible, available.
Right.
What are, first of all, do they really work or help with urticaria, or we need to go and consult a qualified dermat like you?
Yeah, see, if you have not experienced urticaria any time in your life, and this is the first time that you have been experiencing, and it's like I said, it is spontaneous. So you want something to relieve those symptoms, right? So at home, like you can use a few home remedies like applying an aloe vera lotion or rose water or anything which reduce. It will soothe your skin. That's all.
Right.
They're basically relieving the burning sensation.
Uh,
And the chemist, most commonly, they offer a medication called antihistamine. So the symptoms, what you see on the skin, is because of release of a chemical from the cells called histamine. So these medications stop the action of that chemical. So most of these medications are safe, but if your symptoms are not getting relieved with few days of this medication, then it is better to visit a dermatologist. If it is an emergency, then you can pop one or two of these medications.
right. Doctor, as you said many a times, when people are allergic to something, or as a reaction when something triggers, you get urticaria, and it is of acute nature, right? It is not living more than 6 weeks. In that case, if you know what is the trigger, you can avoid the trigger, and you can, in a way, get relief from urticaria. But in case of chronic urticarial hives, people are so confused, so depressed, and so shattered because the treatment is just going on and on, and they want to know. will they ever get completely urticaria free? What's your answer to that?
Yes, I totally understand because it is an agonizing experience for the patient who come to me with these symptoms, which are there since months and years together. And even after complete evaluation, sometimes the cause for the occurrence of this rash may not be found.
Hmm.
So mostly with the literature, we can say around 50% of cases, they are idiopathic. Idiopathic means which has no particular reason why the rash occurs or what is the trigger, exact trigger. So in such cases, there are other tests to find out uh, if it is because of any particular allergen, because we test for certain substances in the blood, so which can be increased because if there is any allergy to a particular substance. So those are called, so if I have to name the test, it's called IgE test or prick test. So we can do these kind of tests in case of chronic urticaria to find out the cause. And once the cause is found, then we can just eliminate it. Or otherwise, we just have to give certain medications that will bring down these kind of reactions. That's all.
Right. What happens? We all know that stress is a big health risk and it can
Correct.
aggravate any health condition. Is it the same with urticaria, doctor? And many times what happens, of course, if I have, urticaria, I'll have stress of having urticaria. Then
Mhm.
again, that stress, if at all it aggravates, then that will increase my stress and make my, plight even more troublesome. So how to manage that?
Yeah, so it's an ongoing cycle. So once you get urticaria, you're stressed that you got the rashes, and again the stress will make it even more worse. So it has been found in studies that both can be correlated, the psychological stress and urticaria. So it's one of those skin conditions which is directly related to the brain. Okay, so there is a signaling system between the brain and the skin. So when you get so urticaria can be worse if you have any psychological stress, and sometimes even in females, the menstrual cycles can cause these kind of rashes or aggravate these kind of rashes.
Right. Now, doctor, when a patient comes to you with urticarial lesions, what are the various tests that you do, and how do you figure out whether what could be the reason? Because for example, I'm eating eggs throughout my life, but suddenly I'm observing that whenever I eat egg, I'll have these hives, or I mean anything else. So how do you find out the cause and how the treatment follows, etc., etc.?
So it's like I said, if it's the first episode, then if you see the cause, like if it is because of a insect bite, suppose, or some unknown bite, some sting from an insect, or so in those cases, no evaluation is needed. And if you know that you are allergic to something, and if you have consumed that food unknowingly, so and the rash occurs because of that, then no evaluation is required. But if you don't know why it is occurring, then there are some screening tests for it. Basically, we are trying to rule out any underlying infection and signs of allergy that we see in the blood test. Okay, and and screening for certain hormonal disorders like hypothyroidism is also a part of the test.
Okay. Now, doctor, is there any dietary precautions or do's and don'ts for patients of urticaria?
So if you're, I mean, you know that you are allergic to something, then better to avoid those things. Otherwise, in Indian population, so unlike the Western population, hardly people are allergic to nuts or cow milk that we consume on a daily basis. It's a part of our diet, and people who tend to try new things like maybe seafood or a certain kind of fish. So it's maybe because of that if they got the rash, then have to just avoid them, and certain vegetables as well. You know that if you are allergic to something and you try it, then better to avoid it. That's all. Other than that, no other dietary restrictions. And one more thing I want to add is people who consume outside food. So the main cause of allergy is the artificial coloring agents.
Okay.
So it's only mostly the fried foods. So the
Mm-hmm.
artificial coloring agents are the major cause of urticarial reactions.
Okay. Now, for example, again, if it's my first episode with the urticarial lesions and I don't know, what went wrong. Normally, what do you suggest such patients? Is there any, way of noting down the routine? Because as you said, anything can cause urticaria under the sun, and even sun can cause urticaria. So, is there a way of, noting down or making a diary or something from which it becomes easy for the doctor to find out, okay, there is a correlation whenever you eat something or whenever you are exposed to sun, you're having it. So is there a way out?
Yeah, the one who is getting these rashes on and off should ask the following questions to themselves. How did they
Mhm.
start? Okay. Since how long they are there? And how frequently do they occur? And what time of the day do they occur? Is it more in the evening or early morning at night? Then so you are all right in the night and suddenly morning you are getting these rashes, and try to find if you are getting bitten by something unknown like some insect or something. And people have a habit of going out, going around, and mostly to the parks or grounds. Are you getting these rashes after engaging in those activities? Any particular activity, maybe gardening, or if you have any pets at home, can be because of that. So these questions, and also, yeah, as you said, to make a note of the activities or the food they have consumed, and try to form a, I mean, the link to the rashes can be found out in this way. So that is what we advise.
Fair enough. Doctor, another very common problem with us is that we normally don't follow the prescription or the duration of the treatment. So what happens, for example, I'm your patient, you have given me a prescription to follow the medication, whatever for say 2.5 months, 3 months. I'll do it for 15 days, 20 days religiously, and then whenever I'll see some relief, I'll stop it, feeling that I already have the prescription. So in case it relapses or recurs, I have the prescription. I can take the medicine and start it all over again. So I'm sure you also get patients like that
Yeah.
who don't even inform you but stop the medication in between. What's your advice or take on that?
Yeah, so there are two reasons for someone to stop the medication. Either the medicines, they're not comfortable taking the medications, or they are causing some kind of side effects, maybe drowsiness or something interfering with their daily activities. And some people, without any side effects, they are just afraid that they may get any kind of side effects. So proper counseling is part of the treatment. So it is on the part of the treating dermatologist to make sure that the patient follows the prescription. And people, like you said, once they are relieved of the symptoms, they tend to stop the medicines. In such cases, like we have to prove them that there is some kind of allergy in their body. So in those cases, we require lab investigations just to prove that they have this allergy and they need to continue the medication. That is what I follow. So
Right,
unless there is a proof, the patient may not agree to continue the medicines.
right. Doctor, is urticaria contagious?
No, not at all.
Okay. And many a times we have seen it during COVID as well, COVID time as well, that after any infection, especially a viral infection, we see hives on our face, body, etc. So, is there a correlation between infection of virus or bacteria?
Yeah, definitely. So urticarial rashes can also occur because of an underlying infection. It can be viral infection, bacterial infection, or any parasitic infection. So yeah, COVID is also viral infection. So people can see these kind of rashes even in case of dengue or chikungunya fever.
Yeah.
So there is a correlation. That's the reason that we do the blood test, so that we can find out if there is any underlying infection and treat those infections. Then automatically the problem of the rashes is also solved.
Right. So the bottom line is that we need to find out the trigger. If we know the trigger, it's easier to manage the whole situation.
Yes.
Okay. Now, Doctor, before we sum up the whole session, any take home message for our viewers?
Yeah. So if you get a rash, so and which is of sudden onset. So So don't be afraid. So just try to consult a nearest doctor so that he can rule out what exactly it is. And if the over-the-counter medicines don't work for a long time, see, please don't continue them. Consult a qualified dermatologist.
Popping pills without proper prescription is just not a good idea.
Not
Don't
advisable.
risk your health. Go and consult a doctor. You'll surely get relief. Thank you so very much, Dr. Anirudh. It was wonderful talking to
Thank
you.
you.
Thank you for your valuable time and making
Thank
this
you.
whole session so informative. Thank you so very much.
Thank you. Thank you to all the viewers as well.
And thank you, Doctor. It was a pleasure. And viewers, thank you for your excellent participation in today's session. And I'm sure at least now we know that what is urticaria, how to prevent ourselves and our near and dear ones from getting urticaria. And in case if we get to see such symptoms, at least now we know that self medication is a big no no. It's always better to approach a nearby qualified dermatologist. Thank you, everyone, for your participation. And to get latest updates on how to keep your skin healthy, do like and follow our FB page, all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you, and have a great day ahead.